We'll now look at the structures you can see on the surface of your hand. These landmarks help you express where you are proximally, distally, and laterally, so you can record your findings in a reproducible way. Let's start by looking at the palmar creases. I'd suggest that you examine your own hand while you watch this. The distal transverse crease, or the heart line, runs across the upper palm near the base of the fingers. The proximal transverse crease, or the headline, runs across the middle of the palm, typically below the heart line. The thenar crease, or the lifeline, curves around the base of the thumb, forming a boundary between the thenar eminence and the rest of the palm. These are the interphalangeal joints, the PIP joints and the DIP joints. The thumb only has two phalanges, so it only has one interphalangeal joint. When you try to find the MCP joint line, this doesn't actually align with the creases at the bottom of the fingers. To find the MCP joint line, make a fist and you'll see where the knuckles are on the back of the hand and how they align with the folds on the palm, which is a couple of centimetres more proximal than you might imagine. Doing this can be helpful for locating the joint and also differentiating between a Dupuytren's nodule or just an enlarged joint capsule. The thenar and hypothenar eminences are the muscular pads at the base of the thumb and the little finger, and the distal wrist crease roughly marks the proximal border of the flexor retinaculum, which forms the roof of the carpal tunnel. This is important to know, as when you're treating Dupuytren's disease with radiotherapy, you should try to avoid irradiating the carpal tunnel, as it may cause swelling and worsening of median nerve symptoms in some patients. The other thing to recognise is the hills and valleys on the palm. The hills are called palmar monticuli and are normal structures. You can see them better when you put your fingers together. Sometimes patients complain of swelling in those areas, where actually it's just the palmar monticuli that are tented up, and the abnormality is the Dupuytren's disease, making the skin on either side stick down onto the fascia and so exaggerate the height of the monticuli. The web spaces are located between the fingers and are numbered 1 to 4, starting from the thumb side. In patients with Dupuytren's disease, the condition can affect the natatory ligaments, which span these web spaces, leading to a reduction in finger span.